Tēnei te mihi kia koutou katoa, he Maxine Ketu ahau, he pauarahi o Ngāti Hauora Iwi Trust, kei konei a Taumaranui. Recently, we launched our town-by-town Hauora report that our whole community were a part of and informed. From that report, there are many findings, but in particular, the key one that came out from the people was access. Our access throughout our rohe is poor. Some of our areas, they're about a good hour drive to Taumaranui, and then access to services here in Taumaranui, specialist services, doctor services, etc. And then from there, access to Waikato Hospital, an improvement on that access so that things are better coordinated. One of the strengths that came from the whānau voice that informed our Hauora report was the solutions that our whānau were able to suggest that could contribute to improved health outcomes. They were really reasonable, they were practical, and they were also considered in terms of they knew that those outcomes wouldn't happen overnight. It would have to be a strategic, long-term plan and investment to achieve education around access, collectivism of services where people are communicating and talking so that there isn't a duplication, so that timing is better aligned to get access, utilising our local hospital, which is a great facility up on the hill, and bringing everything together, so creating that hub environment. The strongest thing was advocacy. The key thing the community really felt vulnerable around was a lack of advocacy for their needs, for our needs here in our rohe at that high level. And if we go back to the COVID-19 situation and our iwi response, we sat alongside the public health unit and we were able to advocate. We had line of sight of everything that was coming into our community and going out. So we were able to advocate strongly to coordinate services in, services out, and holding the system to account, including service providers and PHOs and health providers, etc., but also whānau, because in the mix, whānau are also responsible for their health outcomes as well. Right now, the fight is to try and get that mechanism in the system, like we had under COVID-19, to hold the system to account. That is missing for us here. I just want to acknowledge our whānau for participating in that original whānau voice process that we shared together, and the results and the evidence that we were able to collate from that piece of work that has contributed to our overall Hauora report, and that has given us the priorities that we need to drive to improve access and equity in health for our whole community. Without it, we wouldn't be where we are today, where we can firmly hang our hat on what are we here for, who are we fighting for to improve our health outcomes overall. Nō reira, kia ora koutou.